Healthy Lives, Healthy Futures is a fundamental review of how we can improve health and social care across northern Lincolnshire, including both Grimsby and Scunthorpe. What we're looking at is a completely fundamental overhaul of the way in which care is delivered. We want to support families and communities to be able to help themselves and their families and friends with managing their health and well-being. We want to bring out more care into the community to support them when they need it. And we actually need to think about how can we organise hospital services in the most effective way. What we want for the population of northern Lincolnshire is that the population can have access to the best quality services that are available anywhere in the country. We're facing a lot of challenges with respect to Healthy Lives, Healthy Futures. We have an ageing population, and with that age comes an awful lot more demand in terms of chronic diseases such as diabetes, heart disease and the like. We need to make sure that we can respond to that. We need to be able to respond to people's expectations and their demands of the health and social care system. We need to be able to make sure that we create appropriate working arrangements so that staff want to come and work within this area. But we know that to be able to meet all of those aspirations, it will be a real challenge given the financial climate that the NHS and social care finds itself in at the moment. So we need to radically come up with some different solutions. The purpose of this video is to start to think about two of the first areas that we're looking to work on. One is improving ear, nose and throat services, and one is about improving the stroke care for people within northern Lincolnshire. The purpose of this consultation is actually to start to go out and talk to the public about why we think those two services need to change and our recommendations for what we think should be the preferred option.
We're not aiming to look at services in isolation. We are wanting to consult with the public, patients, staff, stakeholders of northern Lincolnshire to develop services that are fit for the future of the community and will last us for years to come. This consultation is part of that process to help us shape the services of the future, and we need your help to do so. As we develop further changes to services, we will be coming out to consult with you for your ideas as well. Our aim is to provide the right care in the right place at the right time. This is going to mean that we have to do things differently. We want to provide the best quality care, but within the financial budget that we have. This means that things will be done very differently in the future. We want to focus on a few key principles. Our priority is providing high quality care for our patients. We also want to use national best practice. We want to provide 7-day services rather than restricting it from Monday to Friday. We want people to take more responsibility for their care and become more involved in managing their care, and we want to work with other organisations to provide care for people. We also want to provide more in the community and closer to people's homes. This will mean services are delivered and look very different in the future.
We launched the programme in July 2013 with a 3-month engagement, and in that we talked to the public about why we needed to make some changes, what the vision might be and the process we were going through. We received some really positive feedback on that, but we also received some feedback on areas where we might want to do some more work. So for example, what the transport implications might be if we move services. We launched the second public engagement phase in February and March 2014, and that gave us a chance to come back out and talk to people in more detail about the vision and about what that might mean in terms of our vision for self-care, more care closer to home and in the community, and to think about what some of the services were that might need to change.
I think we learnt a lot from talking to the public, but there were two key things that I draw out. The first is that people are really comfortable with the vision that we've got and about people taking on more responsibility for their care and for wanting to be independent and in their own homes, in their own communities for as long as is possible and safe and reasonable. However, it was really clear that one size doesn't fit all. So for some people, they'll be able to look after themselves quite confidently and comfortably with hardly any support at all. For other people, it will need to look quite different. So we are very conscious that we're going to need to think about doing things that work for individuals and not just a blanket approach. The second area that was particularly highlighted was a question that we asked around people's willingness to travel when you needed to travel to get really good quality and safe care. And people were clear that they were comfortable with that, that's something they would want to do, but they were concerned about the practicalities of it. So exactly how would they get there, how would friends and relatives be able to get there to see them, how would they get home again. So we're very conscious that we need to be doing a lot of work around transport. We're very aware that we need to reassure the public about transport issues, given that it's such a critical concern. So we've looked at how people get to services at the moment. It's one of the questions we ask people during the engagement phase. We've looked at where people live and how long those travel times to services will be affected, depending where services are located. And all of that's been included in the publications that we've put out to support the consultation at the moment. We've also got a transport group with lots of different people from different agencies and representing the public coming together to look at the issues that will arise or could arise if we were to move services and how we would mitigate those issues and make things better.
Well, following that engagement and taking on board all the feedback we'd received, we went away to refine the options, look a little bit further at those, talk with local clinicians and service providers about how we might respond to those. There's two hospital services though that we'd like to talk to people more about in this consultation. Hyper-Acute services and ear, nose and throat inpatient surgery. And for both of those, we feel we need to improve services to improve quality and safety. We've identified for each of those 4 options. We've scored those against a set of criteria that we agreed at an earlier stage and engaged on. We've identified a preferred option through that scoring, and we'd like now to come out and talk to you in more detail about why that's our preferred option and what that would mean for the future.
The reason we chose the 2 services of hyperacute stroke and ENT inpatient services was primarily around the opportunities to have better quality and safe services. Hyperacute stroke services had already, for safety reasons, been temporarily sited at Scunthorpe General Hospital, but we hadn't had a consultation with the public about that, and we clearly need to do that before we make any permanent decision. For ENT services, it was very much about the clinicians and the staff involved in delivering those services saying that they're not as good or as safe as they could or should be, and that we needed to make changes. And that's why we've been bringing this one forward to consultation.
My name's Sharon. Part of the responsibility of my job is coming to A&E to assess patients when there's been a pre-alert from the ambulance crew or from the GP or from Grimsby Hospital or Gould Hospital to say there's a query fast positive coming into A&E. All patients are classed as stroke patients until they've had a rosier done. The patient coming to A&E via the ambulance service. There's an A&E nurse to greet them. Hopefully one of the stroke responders is in situation as well. We introduce ourselves to the patient, get a history from either the patient if they're able to talk, or get a history from the family or carers if they've come from a nursing home or residential home. And then with the A&E staff, we do the assessment on the patient.
And after seeing these patients in the A&E department, these patients are moved to the stroke unit, hyperacute stroke unit care, where we do a continuous physiological monitoring of these patients for up to 72 hours. And evidence has shown the stroke unit has reduced the morbidity and the mortality of those patients.
Before the hyperacute service started, it was mainly an 8 to 8 service, Monday to Friday. There was no weekend or bank holiday service. It was the responsibility of one of the nurses on the stepping stones unit, as it was called then, to come to A&E to assess the patients. That was only available if there was enough staff on the ward to be released to be able to do it. Since the hyperacute service has started, it's now a 24-hour service, and there is designated nurses, being the stroke responders, to actually come to A&E to assess the patients. Since the hyperacute service has been at Scunthorpe Hospital, the benefits to the patient have been that they have a designated nurse that comes to assess them, sees them through from transfer from the ambulance crew to assessment in A&E and then to admission to the ward. It takes a lot of pressure off A&E staff because then they don't have to find a nurse to look after the stroke patients. It's also better that the patient has a named nurse that actually looks after them throughout that journey, and they have a face and a name that they can recognise.
Centralization of the stroke services is going on nationally at the moment, and the model was started from London model, and it has shown that it has improved the outcome of the stroke patients. And centralization in the rural area can be tricky business also, but we have done our centralization on 4th of November last year due to various reasons. Obviously the centralization has improved our outcome, and we have focused on one site, and we have provided the expertise taken from both hospitals, including doctors, nurses and therapists, and we are looking after these patients up to 72 hours in Scunthorpe General Hospital.
The preferred option for hyperacute stroke is actually to build on the successful service that we've had as a temporary solution and make it permanent at Scunthorpe. Before Christmas, we had arrangements in place that meant that depending on when you had a stroke, it was a bit of a lottery as to whether you had access to hyperacute services. We considered 4 different options. One was continuing as we are doing. One was about trying to go back to maintain services at both Grimsby and Scunthorpe. This was dismissed because actually to maintain the workforce 24/7 at both sites was really unrealistic. The thought of bringing it to Grimsby, actually there were some practical problems with that because you need 2 CT scanners to be able to run the service 24/7, and we've only got one at Grimsby. The third option we considered was actually centralising the service somewhere more remote, and one of the considerations was whether it could go to Hull. There were some practical problems associated with that in terms of whether Hull could cope with the extra patients, and actually it would be an incredibly busy unit which wouldn't be helpful in terms of patient experience or indeed the workforce working within there. So our recommendation is actually we make the arrangements that are in Scunthorpe at the moment permanent. We're getting good outcomes at the moment, the feedback is very positive, and we think that we should take away some of the uncertainty and make that the final recommendation.
When we came to the preferred option being staying with the service located at the Scunthorpe General site, we were very clear about what it would mean for patients. What we were looking at was that having access to really good quality services for the first 72 hours of care when the immediate decisions about life-saving and life-improving treatments need to be made was absolutely critical, and therefore being at one site that would do that was really key to us coming to a view on a preferred option. However, we're very aware that that means that patients have to travel, or some patients will have to travel significant distances for that first 72 hours. So we were very careful to make sure that we had a pathway that returns people to their local hospital as quickly as possible, immediately after they've received what they need in terms of that immediate high quality life-saving treatment, and that the majority of their care will be provided much more locally, still in very good quality facilities and still with high quality of care, but closer to home and families.
Currently, ear, nose and throat services are provided by Northern Lincolnshire and Goole NHS Trust across the 2 areas where the 2 hospitals, or the 2 main hospitals, work: Goole, Louth and Mablethorpe. Currently, the patients from all those areas go to either Scunthorpe or Grimsby for their inpatient surgery. Outpatients happen all over the patch. A day case surgery happens both at Grimsby and Scunthorpe. And at the moment, we are having to consider how we run that service because we have concerns about patient safety related to not to the actual operating that goes on, but to the on-call arrangements, which currently are split between the 2 sites. Whilst we can have hospital at night doctors at both ends of the patch, we can't at the moment have a rota whereby we can offer the middle grade or the consultant and the consultant at both ends at the same time. But we're hoping that the arrangements that we've considered would mean that all outpatients and as much day case surgery as possible stayed exactly where it is. The options we considered, I suppose, were what always happens: leave it as it is, which at the moment leaves big holes in our cover because of the problems with doctor rotas. We are running into problems even this summer because of that. The option to move to Scunthorpe was obviously, and centralise our services in Scunthorpe was one. The option of moving to Grimsby was another. And the third, I think, a very unpalatable option was to actually consider moving our centre of operations even further afield and send patients out to a tertiary centre outside the Trust's boundaries. The options of moving to one side or the other still protect all the outpatient and day case surgical options. It is just the inpatient surgery option and the on-call arrangements to have a sustainable middle grade rota with a safe one point of call that we are wishing to alter.
Our preferred option is to centralise ENT inpatient surgery at Diana, Princess of Wales Hospital in Grimsby. This would still mean that day care, outpatients, day case operations would still stay at Scunthorpe General Hospital. When we were scoring this, the quality scored the same at both sites. However, Diana, Princess of Wales scored higher as it sees more patients and it has more theatre space there. It also has outpatient clinics in Mablethorpe and Louth which feed into this, and we have to take into account the needs of people outside the area as well.
The option that I believe everybody at the moment feels is the most appropriate option is to centralise inpatient and on-call services at Grimsby. I feel this fits in reasonably well with the figures that have been produced as regards where the patients come from that use our services. The good thing about making a robust on-call system hopefully will mean that we are not ending up with odd transfers and uncertainty when the call changes from one centre to the other.
We're now launching this formal public consultation on two specific areas, but actually we want to have a much wider discussion with the public about not only these two areas, but how can we continue to improve other services. I think one of the differences about CCGs and the old arrangements, it's about getting doctors and nurses out there talking to the public to hear your anxieties, your concerns, and more importantly, your suggestions for how we can make improvements. So we're asking you to come to us, to talk to us, and give us some real ideas about how we can move things forward.
It's very simple to get involved, and I do hope people will do. You can visit our website if you're online. The details of our consultation are on there, and there is a simple questionnaire which will take only a few minutes to complete. We're also holding a number of public events, both roadshows and meetings for people to attend. There is a booklet which you will find in various public places, including your GP surgery, and there's a short, simple questionnaire in that with a free post address, and I do hope people will take the time to fill this in and feed back to us. The end of the consultation is the 26th of September, so please do send us your responses.